punctuality. So good evening, good afternoon, good morning, depending on where you're joining us from. It's a pleasure for me to welcome you to today's daily lightning session. It's our 5th session. Today is the 4th of August, 2020, and we are excited to have you with us. As always, as you're joining in, please just type your city and your country in the chat and ensure that your message is addressed to all panelists and attendees. So if you're using Zoom, there's a possibility to address a message to all panelists or to all, but what we want is for you to address your message to all panelists and attendees so that everyone that is in the room will be able to read. And that said, I want to say a warm welcome to Lizzie Igbine from Nigeria, to Nura Musa Abubakar from Kano in Nigeria. Great to have you with us today. Welcome, Jana from Abuja in Nigeria. We also have the Q&A, and notice that some of you already started using that. So if you have any question that you want answered, you go to click on the Q&A icon on your tablet, on your phone, or on your computer, and go ahead and ask your question, and it will be a pleasure for me to get it answered on this platform during this session. So just a gentle reminder, we are in week 2 of the IDS engine. That's the week from the 3rd to the 7th of August. And remember, last week, we were supposed to join the IDS engine, explore it, and share our experiences and ideas. And the response was remarkable, far beyond our expectations, because in just 5 days, we got over 1,000 ideas that were shared. And so we thought if there are this many ideas, then it will be good for people to get the opportunity to share their ideas, to share as many ideas as possible. So this week again, the IDS engine is still open. So if you have not yet shared your idea in the IDS engine, don't worry, it is not yet closed. You still have this week to share your ideas, and you still have this week to go through the ideas that were shared by your peers, to comment on them, to vote for the idea that you think that is quite remarkable and could be useful in your context. So just go ahead and do that. So that is the reminder that we have concerning the IGS engine. But one thing we have to know is what is required of us. We have 7 strategic challenges that were identified by scholars, by immunization professionals from all over the world, all levels of the health system. And these challenges are those that are shared in the IGS engine. You select a challenge that pertains to your context, that you've identified in your context as limiting immunization performance. And then if you have an idea concerning that challenge, we will want you to share that. But before you share your idea, what do you have to consider? You have to make sure that the idea you have identified that is specific to the context of COVID-19 is in response to a challenge that is occurred because of the COVID-19 pandemic. Have you chosen the right challenge to share what you do concerning the idea? So it's among the 7 proposed, but it may happen that your challenge is not, it concerns something else. No problem, you can still share that. And then you should have a good title, a title that is related to the idea that you're sharing, so that your colleagues will understand the idea your idea is about. And then what you need to describe in order for colleagues to understand it. It has to do with the action steps that you have taken. So can you answer each of these questions? The what, the where, the who, the 5 W's plus the how. And then there's one thing we just want to remind, please, if you use an acronym, it will be good to define it, because in different countries, we are a global community representing almost all the continents of the world. And so in your context, you may have acronyms that others don't know. So if you use an acronym while you're sharing your idea, it will be good to define that acronym so that the peers are not lost. Okay, so we have here Francois Gaz. Unfortunately, is not with us today, but though he's not with us, he left some useful tips and he asked me to share these tips with you. For those who have already submitted ideas, if just an idea or ideas in the idea engine, the good thing is you have the possibility to edit the idea, to improve upon it. So what Francois asked me to say is that he would love all idea generators to review their input. And you can review your title, put a title that reflects upon your main idea that will help you to overcome the challenge that you're facing. Oh, sorry. Secondly, it says that you revisit the question on how to make the idea happen with a list of action steps, also specifying with whom, how, and when. You know, if it's an idea you already carried out, or if it's an idea you're still going to carry out, you know, it's good to precise that. And you may have, it's possible that you may have 2 or 3 priority ideas to overcome one major challenge. That is fine. It's no problem. There's some people that have submitted up to 7 ideas. We know a peer from Nigeria, a scholar from Nigeria, submitted up to 7 ideas. So if you have more ideas, you submit it. There is no one magic bullet that can solve all the problems, the challenges that we are facing. So you can submit more than one idea to solve one particular challenge, and all those ideas are welcome to the idea engine. So just go ahead, don't hesitate, share your ideas. Now I've been speaking for almost 6 minutes, so it's the time for you. You know, these sessions are sessions in which we share. So it's time for you to be able to speak. And if you look on your screen, you'll see a list of questions that we have prepared for you. So if you would like to answer these questions, I'll invite you to raise your hand, and I'll be glad to ask you to unmute yourself and attempt the answers to these questions. So I see, Hassan, you have shared your question on the chat. So my question is, I have submitted my idea in the ideas engine, but unfortunately, I didn't see my name in the list of those who submitted their idea. So the question I would like to ask you, Hassan, is, were you able to download the slide deck for yesterday's session? If yes, you know, there was a list of so many names, and the font was quite tiny. So please just go ahead and check out your name. If you submitted just one idea, your name should be in the list. If you submitted in the list or on the slide deck, so please just go ahead and check. I'm sure your name is there. If your name wasn't there, maybe it has to do with the time in which you submitted the idea. Maybe you submitted the idea after when the list of those who are submitted had already been downloaded and put into the slide deck. But no worries, there is no penalties associated with that. Okay, the ideas we submit on Soini Sanyal from says, the ideas submit on ideas engine, does it have to be related only to our identified challenge, or it can be different categories too? Yes, if you have more than one challenge, Soini, you can submit ideas that are based on different challenges. There is no problem. So if you have, VPD outbreak is a challenge for you, fine, you can submit an idea concerning that. And if demand, you know, caregiver reluctance is a problem, that is your challenge is to increase demand immunization services through communication with caregivers. If that's another challenge, then please, you can also submit an idea in that light. All right, so that said, I want to thank you for these questions that are good. Tosin Onasanya, I see your hand is still raised. You're welcome, Soini. I see your hand is still raised, so I'm inviting you, please, can you unmute yourself if you want to answer this question? And I'm also encouraging all the others in the room, if you think the questions that have been shared here, you know, you're just going to tell us about the immunization challenge you're facing within the context of COVID-19, the idea that you have to handle the challenge, and to tell us about your idea, and to tell us if you've already shared the idea in the ideas engine or not. All right, so I see a raised hand here, Dr. Sida Lingai, and forgive me if I don't pronounce your name right. So please, will you kindly unmute yourself, and then you have the floor. Greetings to you, Doctor.
Yeah, good evening. Thank you for giving me this opportunity. So
the pleasure is ours. So please, can you just tell us where you're calling from, and then you answer the questions?
Yeah, I'm calling from India, state Karnataka. So actually, we are also facing this COVID-19. It is still, the peak is going up. We have not yet seen the any decline or anything like that. So we are facing even immunization challenges and other health service delivery challenges. So I work in a district context, few districts. So I support I work for WHO as surveillance medical officer, and I support the governments in immunization and disease elimination, eradication, and other areas. So actually, there are so many challenges, but one of the challenges was like regarding this vaccination of school children. So that we used to do every year in the month, like after admissions in the month of August, July, August. So since schools are closed now in almost all parts of India, uh, so we face this challenge that the outbreaks of vaccine provider like diphtheria and especially diphtheria is very in the recent years we have seen a higher number of diphtheria cases reported. So we were focusing on school immunization and to increase the coverage of DPT and TD for at age appropriate as per our national schedule. But this year, because of this COVID, we were not able to conduct those sessions and school sessions because of the school closure issue. Now, alternatively, we have some orders, instructions from state saying that these children need to be identified and mobilized to outreach sessions and covered in those sessions. So this is like this idea I've shared on this ideas engine, and so the challenge is to enlist them, to mobilize them, and to ensure availability of vaccines at outreach sessions. And so this is what I've discussed in my in that ideas engine. Um, I think it can be handled, and uh, there are some there is some success. Some children are covered actually. For this financial year, for 3 months, we expect a coverage of around 25% in 3 months cumulative achievement. To some extent, the workers are able to frontline health workers are able to bring these children to session sites with a lot of motivation and training, and we have trained them. Even we have trained them regarding these safety measures that they have to take at the session sites. And there is a YouTube channel for training that our government has set up. So it's a remote training, not physical sort of training. So to such certain extent, it is being handled, and hopefully in the next few months, schools will be open, and whoever is going to be left, they'll be covered again at school sessions. Yes, thank you.
Okay, so thank you very much, Doctor, for sharing this idea with us. Very interesting and enriching also. So if you have any questions for Dr. Sida Lingai from India, please, you can type in your questions on the chat. And Doctor, I'll just invite you to unmute yourself once again, because I have this question for you. I just wanted to find out now with the outreach sessions, that you're organizing to reach these children at school age, does it include, what about the preschool age children? Is there another strategy for them, or it's an all-encompassing strategy?
Actually, it's all same sessions will be giving services to all age group children. So this outreach sessions normally used to be for less than 5 children, like those preschool children. But
Okay.
this because of this special circumstance, so this school children are being asked to cover in this outreach sessions. So there are so many innovations like local. They have allotted different time slots to these no, there is a token system, and beneficiaries come at different times, and there is a list prepared by the health workers prior, and there is a house visit that happens. So with all the precautions like mask and social distancing, they're able to manage at some places. But the frequency of these outreach sessions is not as per micro plan. Like they're still busy with COVID work and containment measures. So number of outreach sessions are not actually as per our original plan that we used to have earlier. With these limited challenging circumstances, some of them are managing it. And some places still, it's not, I'm not saying all places are doing. Some are doing it, some are still, struggling. So, so this is the actual situation now. Yeah.
Okay, and I'm glad you talked about remote training through YouTube. That's quite interesting. I've not heard of that very often. We've heard about remote training, maybe Zoom and all of that, but YouTube, to me, it's quite new. Now, one thing I wanted, what about parent response so far, to the outreach sessions? How are they receptive?
Yeah, in most places, like, there is some hesitation. Initially, it was more, but now, like they know about, in some way, this COVID pandemic has helped in, increasing this value and understand, people to understand the value of vaccines. So, in some way, in our areas, since the southern part of India is more sort of literate and here receptivity is more, even from the beginning, and education levels are quite high. So literate parents are there. So that's one of the reasons why we don't face much challenges. But there was initially some hesitation because of this, issues like some health workers turning positive, and they objected to these health workers doing surveys in containments and the same workers coming back and doing sessions.
Okay.
But later, because of proper communication, now it is to a great extent it has come down. So not initial months, like in the month of May, June, we had that receptivity issue, but now it is almost it's very much less.
All right.
So they,
Okay, so thank you very much, Doctor. Thank you for your time. Now I'm going to move to the next person, the next hand that is raised, Rashid Nuruddin. Please, can you unmute yourself, and we'll be glad to get what you have to say about the questions that are posted on the screen. So Rashid Nuruddin, if you are getting me, can you unmute yourself, and then you have the floor. And while Rashid is doing so, please, I'm inviting you are in the room. And if you want to, there are few questions on the slide that are projected. If you want to attempt answers to these questions, we'll be glad. I invite you to raise your hand and I'll be glad to invite you to unmute yourself and share your thoughts and your ideas and your answers with us. If not, you could still type your answers on the chat. And I want to recognize, there is Dr. Daniel Dogo from Nigeria that said, the challenge in my state is the non-conduct of outreach immunization sessions. And you went on to say, Doctor, that the challenge is not shared in the IGS engine. So I would like you, if you are here and you are in the possibility to speak, I'll just invite you to unmute yourself, even if it is not, if you're saying that the challenge is not shared in the IGS engine, but can you tell us about it, and what have you done to be able to, address this challenge, so you can still attempt to answer these questions.
Hello?
Yeah, hello. Yes,
Hello?
yeah, good evening, Doctor.
Hello?
Yeah, hello, we are getting you. I hope you're getting me. So you have the floor, Daniel.
Okay. Good evening, everyone.
Evening.
Good evening, everyone.
Evening.
Yeah, just I stated, the challenge is non-conduct of outreach sessions in my state where I work here, and the solution is just one way. It is resuming or
Doctor, please, excuse me.
outreach session.
Hey, doctor, before you talk about the solution, I want to ask you, why did the outreach session stop?
Okay, it stopped because of the COVID-19 pandemic that brought the scare of people who are attending health facilities, and then the health workers too were scared, so they could not go for outreach session because everybody was scared of coming in contact with or having crowd. Hello?
Yes, we are
Hello?
getting you. Yes.
Hello?
It's unfortunately, it's as though we are getting you, Daniel, but it's as if your internet connection, you're having issues with your internet connection. So what made me to ask you that question is because
Yes.
all right. So,
So
I don't know if you can
know.
continue.
Come again?
I say, I wonder, can you go ahead and continue?
Hello?
Yes. Unfortunately, Daniel,
Okay.
Daniel,
So I said the reason why.
Sorry, unfortunately, your internet connection is really having issues, so we may not get to hear you completely today. And don't worry, it does happen. It happens to me too, issues with internet connectivity. But I thank you for opting to share this with us. And you actually typed on the chat, you said the solution is to resume or reactivate outreach session, but it still depends on government directives and commitment and safety of health workers and caregivers, vice versa. The COVID-19 safety protocols at the level to which health workers are. So what I wanted to say is, so you were saying that challenge is not in the ideas engine. So it means that either you have not yet shared the idea, or you think because there is a challenge in the ideas engine. I think I shared, let me go back to this page that has to do with ensure health workers' safety while delivering immunization services. Why? Because health workers were kind of like scared of their safety, and so they stopped going for outreach to the communities for fear of being infected with COVID-19. So the challenge here is to make sure that health workers are safe to be able to deliver the services. And so if you are happy, and the idea that you want to share is to be able to address this particular challenge. So I see there is one other hand that is raised. Yahaya Ahmed, if you can unmute yourself, we would like to hear from you. Yahya Ahmed. I also see Sani Abdul, Sani Mainage. Your hand is also raised. Please, anyone, if you're able to unmute yourself well ahead of time, I'll be glad to invite you to talk. Okay, Yahaya Ahmed, you have the floor.
Hello, good evening.
Good evening.
Yahya Ahmad from Nigeria, WHO. Are you with me?
Yes, we are with you.
Actually, I am happy to be with you in this particular program. I managed to, be up to date because I joined all the groups, including Skype, and then Facebook, and then I have submitted one idea on the engine. Here in Kaduna State, Nigeria, the routine immunization activities is going on successfully. The challenge is the issue of outreach, because initially they do get some allowances for outreach services, and now the allowances is not forthcoming. However, in majority of the LGAs, you can see the LGAs conducting around 70 to 80% of the planned outreach services, while the fixed, where the fixed doesn't need any money, you can see about 97% of the peak session were conducted. So the major challenge is that the outreach is declining. Once you have decline in number of outreach, you are going to get a decline in number of children immunized. So if you are getting a decline in number of children immunized, virtually there is tendency of outbreaks of vaccine preventable diseases. However, the states and the partners are looking from various angles to see how they can revitalize outreach services, and not only that, to ensure that people are coming for to receive the services. If not otherwise, we cannot do away with the issue of vaccine preventable diseases. So what is key is we need to have available funds, and then after funds, then we need to go into mobilizations, because the people doesn't have fear of COVID-19 for now. The fear was before, but now like the fear have gone, they don't have fear, they patronize the clinic for all routine activities or clinic-based activities, antenatal, outpatient, and including the routine immunization. But the major challenge is the outreach. There is decline in percentage or number of outreach conducted, cutting across all the health facilities in the state. So this is the major challenge, but the state team and the partners are doing their own best to see how they can get resources and then support these outreach services, and also to see how the RI providers are going to be trained to ensure that they give their own maximum output to ensure the gaps, the number of unimmunized children are close to the PRS minimum. So this is the few points I have for you from Kaduna State, Nigeria. Thank you very much.
Thank you very much, Yahya Ahmed. And before you go, I think I have just one or two questions for you. I wanted to find out, you said there's challenge, no outreach, getting to organize outreach sessions. I said the outreach sessions are not holding as before because of lack of finances. The allowances for outreach are not available. Is it due to COVID-19? Is the suspension of allowances due to COVID-19, or there is another reason?
Yes, actually, there is decline or reduction in the entire budget of the country, including the states. So once you have decline or reduction in budget, everything is going to be affected. So they have funding, they got funding from January to March, and then from April to date, there is no funding for outreach. However, Gavi is on ground, is trying to see how they can also support. So
okay.
the decrease in funding is in relation to COVID-19 actually.
Thank you.
Because there is reduction in budget. Once there is reduction in budget, then virtually you cannot get some other essential funds required to render some essential services.
Okay, you said something like the state authority said they were going to look at it, how to mobilize funds. So what specific activities that concerning actions, concerning fundraising are they embarking in? Is it like advocacy? What specific fundraising actions are being taken?
Actually, number one is the issue of advocacy major stakeholders. Primary Care Development Agency, in collaboration with the partner, they are going for advocacy, to key ministry and then key officials for them to know the implications of a reduction in outreach, and then for them to, source funds for the outreach. And also the partners, those that are involved in routine immunization, putting head together to see how they can, get some funds from their own organization and then put it together and ensure outreach services were, conducted as before.
Okay, thank you very much, Yahaya. I see Shalini from the Scholar team is here with me. And Shalini, you have listened to Yahaya. He's actually talked about an aspect that we don't hear much. We haven't heard much about it from scholars that have shared their ideas previously. And that has to do with resources for outreach activities. So are there any questions you may want to ask or any feedback you may want to give Yahaya based on what he has shared with us today, Shalini? And welcome to you.
Thank you, Charlotte. And thanks for this great session. Unfortunately, I've been trying to answer the questions in chat, so I wasn't very, very attentive. But yes, as far as resources are concerned, I feel that when you are trying to define your challenge and you want to address it, there are these tips that François and Charlotte have given you, which is who, what, where, when, how. So what you need to do is think about, are the resources in terms of monetary resources, or are you thinking in terms of, HR, or if you could just, could you just quickly tell me, because I was answering on chat. So yeah.
Okay, Shalini, he actually said there was a drop in that is that drop in number of RE sessions because those RE sessions previously were financed. That is the vaccine, the immunization professionals had allowances to carry out RE sessions, but due to COVID-19, there has been a reduce in the budgetary cuts, and so the outreach sessions were no longer financed, and they could no longer go to the field to carry out those activities as they used to do pre-COVID. Okay.
Right. So Charlotte and Yaya, I hope I have your name right. So I would suggest that you think about what is the budget that you require. That is the first question, right? So pre-COVID, what was the budget you had? What is the shortfall? The second thing is, if there is an emergency budget for COVID-19, which might be there because some governments do provide outbreak related budgets, you could look into that and think about how could that be utilized for the shortfall. But the best way to go about it is if you make a framework to say that, okay, these are the areas where the budgets have been cut, these are the issues that we have, then you have to identify who is responsible for the decision-making for budget disbursement. And in case it's not possible in your district, so is there anybody at the state level or the national level who can help you out? And whether you could make a report which specifies what the issues are. Say, suppose it's related to transportation because the health workers cannot reach the outreach points, or it's because they don't have funds for something as simple as the PPEs or just masks and gloves or sanitizers, or is it that, there is shortage of something like syringes or AD syringes, reconstitution syringes. So what you need to do is start defining what are the gaps. And once you define that, what are the resolutions? What is it that you are proposing? And how are you proposing it? And what the budget should look like? So the thing about is when you're thinking in the context of improving a plan or implementing something, the thing that you need to think about is what's your input, what's the output, what the outcome is going to look like, what is the impact going to look like. And if you start defining step by step, then by the end of it, you would have a very clear idea, and that should be shared with the stakeholders so that there can be an outcome and eventually there can be an impact. I hope that makes sense. Yeah. And
Yeah, thank you very much, Shalini, and thank you, Yahaya. We are 5 minutes over the 30 minutes mark, but I think that's okay because we are getting very useful insights and information here today. And I'm sure Yahaya also said, okay, they have been thinking about, the state is already looking into how to supplement, to look for the funds and for
also
outreach services. They have been thinking of advocacy with the
also,
various stakeholders.
If I may add, with experience, even agencies, the UN agencies have emergency funds. Now, I do not know if that's the case in your country's context, but you could also explore with the partner agencies whether they have funds for COVID and immunization. And if the government requests them, and if it is possible for them, and they have a pot or a pool of funds for a short duration, even they can augment the shortfall in resources.
All right, thank you very much, Shalini. I read some very interesting comments in the chat, but there is a question from Effiong Udobong that I really want to address. Good evening, all. I want to ask if one discovered an important points that were omitted in the idea already published. Can it be allowed to edit and resend? Oh, yes, of course, yes, you can edit your idea. And that is why I even shared Francois' tips with you today, because there are many very relevant ideas that have been shared in the ideas engine, but because of the phrase, maybe the phraseology or the detail, they are not really coming out. Even the title that was given does not really enable the scholars, colleagues to get the exact message you want to pass across. And so if you can use these tips, you can revisit your idea and edit it. There's a possibility of being able to edit your idea in the ideas engine. And okay, I thank you, Shalini, for responding to Ponyak's challenge. And I see Soini, you are sharing so many challenges on the chat. So thank you for doing that. We do hope that these challenges, you have ideas on how to solve them, and that those ideas have been shared in the ideas engine. All right, so okay, and I see Sule Salisu Ikara that say, thank you, Shalini. Actually, gap analysis is very vital in the effort of finding solution to any decline program coverage or efficacy. So thank you for that, Sule Salisu Ikara, and thank you, Shalini. Now I see Edda Kanini say, when we start our challenges, will this be done as a group or each with his own challenge? So at the moment, what we're actually doing, and this kind of like joins, there was another question that came in the Q&A concerning, that is this week, the step-by-step process of the week. This week one, ideas engine week 1 and ideas engine week 2. What were we focusing on? We opened up the ideas engine to you for you to have access to it, to explore the engine, to share your ideas. That's your idea, based on a challenge that you're facing in your context. It could be health facility level, it could be district level, it could be a regional level, it could be national level. So based on a challenge that you have identified, and we shortlisted 7 challenges, strategic challenges that you want to address. Now, if there is something that you have begun to do to address that challenge, we want you to share an idea. You say, from COVID-19 was declared in my context, for example, in the month of March 2020. In April, we noticed that there was a 20%, 30% drop in our immunization coverage. We wanted to find out what happened. We discovered that mothers were no more turning up for immunization service. We did a rapid survey in the community. We asked mothers why they weren't coming. They said they were afraid that they would be contaminated with COVID-19. So what do we do to get the mothers to come back to health facility? Number one, what we did is we decided, we held a meeting and said that we need to share, to sensitize the mothers that about COVID-19, how it can be prevented, and that they are in no risk of contracting COVID-19 by bringing their children for vaccination, because we have taken all the precautions. And I told them, these are the precautions we have taken. And so we started implementing the idea from the month of May, and we sent our community health workers to the community to do door-to-door sensitization. We produced flyouts, we used mass media, whatever, that's just an example. And then we discovered in June that mothers started coming back to services. And in July, during our data review, we found out that there has been a 5% increase in our coverage. We have not yet reached the level in which the coverage was from January to March 2020, but we believe that with these measures that have been put to place, there is going to be a gradual increase. So this is just a simple example that I'm giving like that to say, okay, and then there's this question of when did it happen, how, with who? So who are those involved? I talked about community health workers. We talked about some stakeholders like quarter heads or traditional rulers. We talk about the media. So it is the who. When you see, I mentioned specific periods. And then how do you measure change? How do you measure change? So that is it now. There is Peace. I read that said, I didn't get to submit my idea in week 1. Can I still submit it? Yes, Peace. You can still submit your idea even this week. You can still submit your idea. The ideas engine is still open. You have up till Friday this week to submit your ideas. They say a question from Avua Joseph Oteri. Say, hi panelists, have we thought of the overall effect of hesitancy arising from conspiracy theory? That is, Avua, I want to tell you that is a challenge that is faced in certain contexts, and some have proposed ideas on how to address such challenges. So you may want to visit the ideas engine and you'll see what has been written in that regard. Okay, thank you to Ahmed Ejaidi. There's no problem if you have to leave now. Thank you for taking part in this session, and we are sorry for going over time. So right now, I know there are so many things. I see in the Q&A, Mercy A. Onupita, I say, if the vaccination drop is due to finance, please, is it affecting all states in Nigeria or selected states? How long are we expecting the finance to arrive for progress in vaccination? Thank you, Yahaya. Mercy, I think you can visit the Nigeria. You can get to talk more about that in the Nigerian scholar group. Unfortunately, we have run out of time. And I still see Shalini. Okay, Shalini already addressed also in the answering the question of Avua, that if that is your challenge, then you should think about how you could address it, and it would be good to share your idea, the ideas you come up with from the ideas engine. No, San said, my question, when do we expect to start sharing our project? We are not yet started talking about project Nuhusani. For now, we are still in the week 2 of the ideas engine. So please do go ahead and share your ideas in the ideas engine, comment on the ideas of your peers, and also vote the ideas that you find to be the most pertinent. So concerning the project, as from next week, week 1 of exercise 1, we are going to tell you more about the project. So thank you very much for being with us this evening. And thank you, Shalini, for being here. Thank you to Yahaya Ahmed for sharing, and Dr. Sida Langai from India for also sharing their experiences and their ideas with us. Looking forward to meeting you again tomorrow, 6 p.m. Geneva time. Until then, it's bye for now, and let the ideas keep coming.
Bye. Thank you.